Hey there, it's Nash. Today is September 11th, 2014, and I don't have a whole lot of time to make an update, but I wanted to do a little bit of a chest update, just so time doesn't move too quickly along, and I don't have any footage of where my first month took me, so I am 3 weeks and 2 days post-op, and I'm about to take a shower so I can kind of take all this stuff off and kind of talk through it real quick. So I still have these little gauze bandages that I've been using. I replace those once a day with some kind of Neosporin underneath. Bacitracin is what I use, which is just kind of like super plain, simple antibiotic ointment. And so underneath these are some nipples that are looking better and better. Yeah, I mean, I'm really happy. I'm like totally out of alignment and the camera's backwards. So I'm like, oh, I'm crooked. That's better. No, that's worse. Okay. Yeah, so they look great. The scabs are coming off, which is really nice. I don't have an outy part on this one, a nipple that sticks out. This one I have one, but it's this like kind of squished fatty one. So I don't think I'm gonna have like little, tweakable nipples, which is fine. um, but yeah, let's see if I can get. There's still a little bit of unhappiness over here, but for the most part, the scabs are gone. This one has a scab only right where the outie would be, and I'm kind of thinking that it might get to the point where once that heals up, it'll kind of fill in, because it's kind of a little indent right now. So I have these scar strips. I'm using Scarway silicone strips is what I'm using on my incisions, and so they come in these little rectangles, and I cut them in half, and so I use a couple of them, and I think they've been making a really big difference. They definitely make me feel more confident, and just in terms of like going back to work and like reaching for things. I try not to push it too far, and like if I feel tugging, I try to lay off. But just being an active person, because I'm at work and things like that, this feels a lot like that tape that they had on me when I first got out of surgery. It's just kind of confidence boosting because it takes some of the tension off of the incisions. So yeah, let's see. Let's do this a little faster. So this is my chest. It's looking really great. Obviously I have to like build some muscle up. I had less chest muscles than I even knew that I had, but yeah, I mean, it feels just like super comfortable, and it's like, it's not surprising to me. I kind of thought maybe it would be something to get used to, and maybe like the first couple days I had to get used to it, but I mean, it just really feels right, and yeah, pretty, oh, you can't really see, pretty flat, obviously, but not concave. They leave a little bit of tissue so that, you have a little bit of a chest still, and so it doesn't go in. I'm dealing with a little bit, something that I hadn't seen a lot of folks talk about, was dealing with breaking out around my incision lines. You can see I got these bumps here. They've gone down a lot, but they were pretty much just like zits. And I looked it up, but I couldn't find a lot of information about it. I found a little bit from Dr. Garamoni's office, actually, that said that those might be sutures that are kind of still in there and poking out. But since they seem to kind of spread up, I think it was a reaction to being under that tape for so long, because it was pretty much right where the tape had been. And that just like not being cleaned and being sweaty under the binder and the tape and stuff. I think maybe it's just regular old acne, but it does itch a lot, and I felt really allergic, and I have pretty sensitive skin allergy wise, but I felt like especially when I get kind of hot, like temperature wise, that that my skin kind of flares up here and feels allergic. I'm using some kind of like blemish soap on it, which has I don't remember, some kind of certain kind of acid in it that is recommended for like acne and things, and that seems to be clearing things up pretty well. Um, yeah, kind of body acne is not something I've dealt with before, and so it does feel pretty unique. So I'm gonna try to block the sun here. A unique thing. So yeah, feeling feeling really good. Have some range of motion. I'm almost a month post-op, which is they said at Dr. Crane's office that be pretty much back to normal. Then I know a lot of other docs will say more like 6 weeks. So I'm anticipating a little more time, and I'm definitely trying to take my time. You only get to heal once, and then that is going to affect your results for the rest of your life. So definitely trying to be good to myself and heal up and not push myself too hard. So anyway, this is my chest. 3 weeks and a little more. 3 weeks and 2 days post-op. I'm 7.5 months on T, which is great. And I do feel, in terms of a T update, I do feel like my voice is dropping again. Just this week, I woke up and like heard it like 2 days ago, 3 days ago, and it's like down here, and I like can feel it resonating here. Which, when it first started to drop, I started to feel the vibrations in my chest in a new way that I hadn't felt before, and now those vibrations can go down here. Yeah, it's like ooh, I can feel it here, which is cool. It's a cool feeling. But yeah, I am excited to be hearing that, and it's interesting because I just kind of felt like my voice had settled, and now it's all getting unsettled again, which isn't a bad thing. I'm excited about it, so it's feeling good. Don't have a whole lot more to update. Kind of gearing up for my 9 month. Which I think tends to be where I witness, and this is just a theory on my part, but where I feel like folks really start to settle into their bodies and kind of tighten up a little bit and get like kind of out of that awkward, kind of swollen adolescent acne stage. It's just what I tend to witness, is that folks start to really, I don't know, mature physically in new ways at around like 9 months to a year. And so yeah, I think I'm a little bit my belly has gotten a lot bigger than it's ever been, and that makes a lot of sense fat distribution wise. But yeah, I'm looking forward to toning up a little bit, and I think I'll be all the more excited to do so now that I don't have to deal with my chest. A big part of top surgery was just like not having to do so much maintenance around my chest and all of that, and to not have to do maintenance around like my cycle and all of that. I feel like a lot of barriers to activity and barriers to taking care of my body have been brought down, and so that's really exciting. And I look forward to getting in shape for next summer, when I'm going to be able to go without a shirt and all that. All right, that's it for now. I have to get to work. I have to get in the shower, and I have to get to work. Again, September 11th, 2014. I'm 3 weeks post-op, and I'm 7.5 months on T. All right, signing off for now. Bye.